So I made a long time ago this memorable prosthetics, which is I still remember. It makes me happy, and then I made patients happy, and then I would like to share with you beside this techniques. So patients questioning regarding communication, regarding their final prosthetic, what should I do? So I got a lot of email from the patient. But like I said, I'm not a doctor, I'm a lab technician. So you have to consult with a dentist office too. Anyway, this case came down patients and he's not happy with his prosthetics because he cannot explain, his dentist cannot explain, and the dentist did not use me at that moment. So I have to see the patient so we can discuss together, and then we consult together. So I noticed that their previous lab fabricated, which is pretty decent, not bad. And then he said, look, I'm not happy about this. I asked him, what is not happy? Well, I don't know, but something is not right. I said, okay. What about your temporary, right? A little bit bulky, fat. What do you think? I kind of like it, but to me it's really ugly. You know, as you can see, their temporary is really bulky, zigzagging teeth. It's not right. So I got some idea from him. You know what, Mr. Gentleman, can you bring your young age photos? I asked him. I said, what are you talking about, Luke? I just need a young age. What years old? Doesn't matter, 13, 20, 25, doesn't matter. Okay, so let me double check that I can bring down the photo for you. So finally he did it. But it's not as good as what I thought. But I saw that he is a younger brother, and then he has his picture. And he said, unfortunately, my younger brother passed away. I said, I'm sorry about that. But I noticed that his tooth is bulk teeth. You know what I mean? The bulk teeth. If I make that much out, usually people don't like it. So I got some notice that when I see this gentleman wants the bulk teeth, just looks like miss his young age. You know, 14 years old, that age, I got ideas too. So this implant, somebody made a long time ago. This is a little bit frustrated. I cannot find the part, nobody made it. But he had it a long time ago, so I have to repair those kind of things. So he understood my procedures. I told him I cannot use your previous framework, but I'm trying to. But I make another framework design, nice form out, especially inside edge too. And then finally I made it. It's good restorations without make happiness. You know what he likes it? He likes the supporting the gum underneath, which is his right, because whenever I made under contour, and the lips will be a little bit shrink, get more wrinkle. So that's why we have to make the more firm inside and supporting outside. But sometimes patients said bulky, but that's the great format. And then we made the pink tissue underneath. It's pretty simple, I'm not really exaggerated. And we make the final prosthetic. Anyway, this pandemic season, so everybody, down, depressed. But I would like to share with you guys, especially laboratory technician, whenever we think this is right, and then we can do better, just like treat it, just like my teeth. So anyway, this kind of very good example, and I would like to share with you, and then you can get some credit, and then you can make some better in the future restorations. So we have to listen to what patients said. We have to figure it out what patients want. The most memorable full mouth restoration, I feel good, so happy, because I gave him to, back to kind of young life, that's what we have. I'm 53, All right, so this gentleman at that time was 71. Okay, seasons of life. Okay, so I wish you had a good spirit and a good energy. And the next videos I'm going to share with is what is the successful full mouth implantology. I'm trying to explain to you which full mouth cases do I have to get it. Do you have to get it? All right, there was another one's coming up. Then see you next video. Thank you very much.